morning, guys. It's Dr. Greer. I haven't done a particular video on this topic, so let's talk about when you need to stay in the hospital after surgery versus go home. I trained back in the mid 2000s, so 2007 to 2012, and where I trained, all of our abdominoplasty patients stayed after surgery, our breast reduction patients stayed overnight, our breast reconstruction patients stayed overnight. I remember scrubbing with some of the private practice attendings and being shocked when they sent a patient who had abdominoplasty home or a patient who had brachioplasty, an arm lift. And it's funny because now in my practice, I send everyone home. And I think a lot of that is the types of cases I do. They're all cosmetic elective. So they tend to be, very healthy patients with no medical problems. If you do a breast reconstruction, for example, immediately after mastectomy, it's actually the mastectomy recovery that's more the hard part for the patient than you popping an implant in there. So having super healthy patients, elective procedures helps. And then also what I use for pain control helps now, because we used to just slam everybody with Percocet, which makes you nauseated and doesn't necessarily help the pain. Now I use a combination of non-narcotic pain medications with oxycodone as needed, and I do nerve blocks. So we get people up and moving right away, which is really better for them in the long run. In terms of length of surgery, the American Society of Plastic Surgeons position statement on ambulatory surgery, meaning outpatient, is that it should be 6 hours or less. I do know some surgeons who operate longer than that and send people home and their patients do great. I have that 6 hour cutoff in part because of the recommendations and in part because I just get tired after 6 hours. So there are not any operations I do now where people stay after surgery, which is nice because you get to recover in your own home. You're not getting woken up every 4 hours by a nurse. And because of the pain medications we use, your pain is well controlled.